have to confess, we weren't sure, we're 5 people gonna come, and so it's really nice to see. I wanna thank, first of all, Bridget and Evan for agreeing to participate tonight. Thank you, you guys. And this came about because we did a survey last year, and one of the questions on the survey was, if we were to do extra events or in-person events, what type of event might you want to see? And we had a list. And this one, I think it was discussions with state or local lawmakers topped the list. So this is actually the first time we're doing that. We've had a couple of fundraisers and we've done our candidate forums, but this will be the first time. So thank you all for coming and being part of this. I wanted to introduce, so Evan Shanley is our representative for District 24. Represents Warwick and a part of East Greenwich, including this very property, or this area. And then, and you were elected in 2016?
2016, correct.
And Bridget Valverde was elected as a state senator starting in 2018 for District 35, which covers all of East Greenwich, half of NK, and a portion of South Kingstown. So thank you both for being here tonight. I'm gonna sit down. I'm gonna let Bridget maybe start off. And the idea here was to kind of talk a little bit about the legislative process and also what their priorities, both of their priorities are for the year. And then after that, we can take some questions. And we have a tight cutoff at 7:30 because Evan's daughter's birthday is today. So
4 years old. Not going to forgive me if I don't call
we had to work around some things to get a date that worked for everybody, and so we're appreciative. Anyway, Bridget, why don't you start off?
Absolutely.
And no microphones, by the way, so if you're having trouble hearing, just like raise your hand or show your ear, and we'll try to project more. So,
all right. Well,
thank
you, Elizabeth, and thank you to Corinne over there for organizing tonight's event. I'm really impressed that all of you came out in these temperatures tonight. I know that I was reluctant to get out of my sweatpants after working at home all day to come out here. So Elizabeth wanted me to kind of give you a brief overview of kind of the basics of the legislative process here in Rhode Island, because I know not everybody is familiar with how the General Assembly works. I'm one of 38 state senators, and Evan's one of 75 state reps. So all of our districts overlap. The senators overlap with the House districts. We are a part-time legislature, so we are only in session for 6 months out of the year. So our 2025-2026 session has just begun. We started on January 7th, and we will be in session through the mid to late June. So 6 months. We are generally in session on Tuesdays, Wednesdays, and Thursdays, where we have both floor sessions and committee hearings. Although right now the Senate is only in session 1 day a week, while the House is in session 2 days a week due to the Senate President's health issues that have been ongoing, which is another story which I'm happy to get into if anybody wants to ask about it. We all serve on various committees. This session, I am a member of the Health and Human Services Committee, as well as I'm newly on the Education Committee in the Senate. What committees are you on?
I don't know yet.
Oh, you would serve in the House. Okay.
No.
The House has not assigned their committees yet. But what have you served on?
So in the past, I've served on state government and elections, municipal government, and housing, and internet innovation and technology, which was a new committee last session. And I would anticipate chairing state government and elections again. And I've also asked to be on health and human services because I think that there are a lot of issues in that area that need attention, in municipal government and housing as well. But I've been on there for 6 years and I'd like to try something a little different.
Can you please speak up?
Yep.
Speak up.
Oh, just
Yeah,
talk
thank
better.
you.
Yes,
Sorry,
yeah.
maybe we would have been helpful with mics.
So we are right now, we're in the period where we are developing legislation. So the first, basically 6 to 7 weeks of our legislative session, we are developing legislation, working with advocates, working with community members, to kind of decide what are the pieces of legislation that we're going to be introducing and working on this year. Which I think this is a great time for us to have this event, because it gives us an opportunity, to have this listening session, hear from you all, kind of what are some of the things you'd like to see us working on this year, and we still have time to put in legislation to further those goals. So once mid-February, we start having committee hearings where we discuss the legislation. We have public testimony. Anybody is allowed to come and testify on any piece of legislation they would like. And so if there's ever anything that you want to come and say your piece about at the State House, I'm always happy to facilitate that visit. I know coming to the State House is not easy for everybody. It's not a terribly accessible building. It does not have great parking, but I know some of the secrets of how to get in there, so if you ever need help, let me know. Because it really is the people's house, and we want to hear from you, because ultimately we're serving all of you. And then, so during our whole session, the finance committees in both chambers are vetting the governor's budget article by article. And one of the last pieces of business that we do in the end of June is pass the budget for the fiscal year that begins on July 1st every year. So that's a basic overview. Did I miss anything?
No, I think it was a pretty comprehensive overview.
All right, wonderful. Well, great.
So what legislation are you looking to work on for yourself this year?
Sure. You want to know?
I am early in the process, but the topics that I'm looking at this year are education, particularly special education costs, and having the state take over responsibility for special education costs, particularly since I've come into East Greenwich and talked to folks in East Greenwich. The budget can really swing wildly from year to year depending on the student population. Massachusetts covers special education costs at 100% for local school districts. That's something I'd like to see Rhode Island do. That's probably the only financial thing that I'm going to ask for this year, because we do have a significant projected budget deficit, and a lot of municipalities are dealing with budget deficits. We have schools being built in East Greenwich and Warwick. So all the rescue funds from COVID have pretty much dried up. So it is a tight budget year, but that's something that I think everyone can get on board with. So I'm hoping to see some momentum on that front this year, on the education front. When it comes to healthcare, two things that I have been working on is extending coverage for treatment with licensed naturopathic physicians and licensed dietitians. There's some access to treatment with dietitians in Rhode Island, but it's not great. It's not advertised well. Naturopathic physicians have been licensed in the state since 2017, but there's no insurer that covers them. If you go to neighboring states, their insurers cover them, and all the data with treatment for naturopathic physicians have shown that per plan participant, the insurers save money when people utilize this treatment. So coming out of COVID, it's kind of what I've been pushing to try and get our population a little bit healthier. So I'd like to see some movement on those two fronts, and both should be cost neutral, if not present a cost savings to insurers, particularly the state as an insurer. When it comes to housing, the General Assembly has been very busy over the last 4 years. I think last count we're around 50 different pieces of legislation designed to streamline the procedure for building new housing in the state and eliminate some of the roadblocks that have caused a lot of builders to refuse to operate in the state. As chair of the Elections Committee in the House over the past 4 years, we've done a lot to change our elections process and implement some of the things that we did temporarily during COVID, and it's still an evolving process, and everybody comes to the table with new ideas on how to improve it every year. And one of the things that I'd like to see happen is something to change, and maybe this is being naively optimistic that we even can do this, to get away from a system where the winner of the primary election wins most of the districts. And there are some proposals on the table, one of which is called a jungle primary, which would be basically an open primary election, and the top 2 vote getters, regardless of party affiliation, move on to the general election. Then others are pushing for ranked choice voting, which is a little bit complicated to take in at first, but essentially you go in and you rank your candidates 1 through 5, and if nobody achieves 50%, the person at the bottom gets struck, and whoever they have as number 2 goes to number 1, and they continue that process of striking until somebody gets to 50% plus 1, and you're electing people with a plurality, and hopefully more consensus building candidates than we seem to be getting, particularly nationally. And then with my background, my mother spent her entire career advocating for people with disabilities. So there's always at least one issue that I'm working on, whether it's access to providers, care, wages for developmental disability, direct care staff professional. So there's some piece of legislation that I'll be working on in that regard this year. And I think we're going over housing, education, healthcare, and those should be the big things this year. And again, it's a kind of an odd year in that nobody's really got an appetite to spend any money. It's a pretty static budget. We're going to have to find savings in places, so I don't think it's going to be a very popular year when the budget comes out. But unlike federally, we are required to balance our budget every year, so there's going to be some tough decisions that we have to make. And it's good to have forums like this because I can only knock on so many doors and get so much feedback. So hearing from you all would be great in terms of what you'd like to see me and Senator Valverde prioritize this year and as we look at our budget.
For me, one of the things that I have been working on over the last couple of years are reforming the way that we deal with waste here in Rhode Island. So both solid waste, what we do with our organic waste, and how we're handling recycling. I am an advocate for establishing a deposit return system. Might know as a getting thumbs up over here. A bottle bill here in Rhode Island. All of our surrounding states have them. That really increase. They're shown to be the most effective thing to increase recycling rates and also deal with litter and about any bottle bill that I would be putting forward.
Can we pause on the bottle bill just because I feel like that's a good example of a bill that comes up pretty much every year. Like I think there's some legislation that it's almost like it has to be ripe before it actually is going to get traction. Like you kind of put it in and maybe it never even gets to committee, that kind of thing. Is that your experience with a bill like the bottle bill?
So it has been. So it's been an idea that's been introduced for literally decades here in Rhode Island. In the past year, though, we established a joint legislative study commission. So both House and Senate members, along with various stakeholders, have come together in a study commission to talk about what a bottle bill could look like for Rhode Island. And now we have sort of expanded our focus to talk about EPR for packaging, which is extended producer responsibility for packaging. So it's holding producers, so like the brand owners, responsible for the amount of waste that they're putting out into the world through packaging, which would include beverage containers as well. So by bringing together all of those stakeholders, we've got people from Rhode Island Resource Recovery. We have representatives from the grocery industry. We have representatives from the liquor industry, and as well as environmental advocates, all coming together to talk about this legislation. And so having a more robust conversation about these things where everybody gets to have their concerns heard over a series of meetings, not just one committee hearing where we're hearing one piece of legislation, can often move these issues further along than just introducing a bill year after year. So I am hopeful that we can make some headway this year rather than like just beating our head against the wall year after year. That's that. Also working on composting legislation to establish a compost fund to build out composting infrastructure here in Rhode Island, as well as to provide grant funding to things like schools and towns so that they can start composting programs. My kids' school in North Kingstown, Stony Lane Elementary, has just rolled out their an expanded compost program. We've been doing composting on school grounds for a while, but we've now partnered with Black Earth Compost, which is a company some of you might be familiar with. They do pick up at my house. So not really. I don't really want to compost in my backyard because I know I wouldn't actually do it. So they pick up compost. So programs like that, so we can get all of our producers of a lot of organic waste to turn that waste into to something that can enrich our soils, rather than being dumped into our landfill where it will just turn into methane emissions and also just continue to fill up our already rapidly filling landfill, which right now is slated to close by 2046, and it's the only one we have. So once that closes, we're in a lot of trouble because it will cost a significant amount of money to transport our waste out of state. So that's another effort that I'll continue working on this year. Last year, I introduced the Nursing Home Workforce Standards Board Act, which would create a Workforce Standards Board advisory committee to the state to bring together nursing home workers, nursing home administrators, as well as advocates for patients and the Medicaid population, to discuss things like training, things like worker compensation, because right now our nursing home patients and our workers are struggling. Our nursing home care has declined, not at every nursing home, to be clear, but at a lot of nursing homes, because pay rates for our workers are quite low. There's inconsistent training and understaffing. So we did pass that unanimously in both the House and the Senate last year, and unfortunately Governor McKee vetoed it. And so I will be reintroducing that bill this year, so hopefully it becomes law. Let's see, in addition to that, I'm working on a couple of early childhood bills. One to create an IDEA task force. So IDEA is the Individuals with Disabilities Education Act. It's a federal law that makes sure that all kids with intellectual and development disabilities are guaranteed a free and appropriate public education and are getting the services they need. It also covers early intervention. And so creating a task force to look at all of the disparate programs that we have working in Rhode Island, and looking at ways that we can make improvements. Again, make sure that our workers are properly trained, properly compensated, so that we do not keep losing workforce in that area. And let's see, I'll stop there because I could keep on talking because I have a lot of other legislation as well, but I'd like to hear from you guys.
If anybody would like to ask a question, raise your hand. I'm going to ask that you stand up and offer your question, and then we'll go from there. So John, go ahead.
To go back to the very beginning of what you said, Representative, about special education, and at the same time the situation the state has with the overall budget. Do you see having the state take that over? Is that a wash, or is that going to cost more money or less money?
So the state taking it over, I didn't mean the state taking over the responsibility, just the budgetary cost of it. And I think that there's always areas in a budget besides the budget that we have where you can make some choices to set aside this money and take on this responsibility. And the state is better a better fit to absorb a financial blow like that than a municipality is. So that's part of the genesis of this, is that cities and towns, particularly smaller ones, can't absorb these costs easily on a year-to-year basis, and we need to find a better way of doing it. And I think we can just look next door into most of the other states in the country for that model.
I just wondered, how that's gonna fly with the state budget, and because I'm assuming maybe all the town's money comes from their tax base in their city or town, so that would be something they wouldn't have to fund anymore. So it's a question of which pocket the money is coming out of.
Actually, there is I don't know the percentage, Allison Powell, I think are you Allison? In terms of the percentage of this, we do get state funding. Each municipality gets a percentage of state funding. Is it 17% here in East Greenwich?
No, well,
Somebody else
it's
does.
Unfortunately, it is going down this year, the
And it is
percentage
going
that,
down.
yeah, there's a state share ratio, which is how much our public education is funded with state dollars and with local tax revenue. East Greenwich, being a wealthier community, is given less state aid than a lot of other towns.
I have a question about this topic.
Okay, go ahead.
Oh, sorry. I'm a resident and I'm actually a special ed teacher in town. So I was looking at the budget, and East Greenwich is gonna take like the largest hit out of all the towns in Rhode Island. So when you compare, I'm just curious to know what you guys are thinking about how to rectify that, because it's like, I think Central Falls, if I'm looking at this, it's like $500,000 that they might lose, but we're $800,000.
Even, yeah, so she's talking about the governor's proposed budget, which was
Yeah.
just last week. The budget process starts now. We aren't gonna see the end of it until June.
Yeah, so the
But-
governor's budget was just released on Thursday, so I know Evan and I are still digesting it. I was just given yesterday the Senate Fiscal Office's first look analysis of the budget. And yes, the governor's budget proposal does not look great for East Greenwich education aid. I'm not gonna sugarcoat it. The funding formula that is used for education aid has a lot of different inputs. One of them is based on the municipality's ability to raise money from its tax base. So East Greenwich, being a wealthier community with high property values, higher incomes, even cost of vehicles go into that calculation.
Right.
And we just had a reval.
So
But even like looking at Barrington, like Barrington's only gonna take a hit of $400,000.
So this is the jumping off point. We have just received the budget. The budget will not be voted on for another 5.5 months, and so in that time, the General Assembly makes a lot of changes to the budget between now and the end of June, often at odds to what the governor has proposed. Now, I'm not promising anything because I cannot, because as you know, Evan said, it's going to be a tough budget year because we don't have that federal funding anymore that came out of COVID. But I think what Evan and I can guarantee is that we will do whatever we can to fight for education funding for East Greenwich.
Okay, thank you.
Yeah.
Denise, sorry, I'll get to you.
Denise Lopez. I was just gonna ask another question with regards to special
Just-
education.
A little louder.
Are our special education numbers, the number of students going up, and does that get taken into consideration when looking at the amount of, because it seems like our number of students that we're servicing is higher, which would mean that we should be getting more aid versus the taxpayers.
Yeah, that might
incurring
not
more.
be a
I'm just
question
wondering if we
for
have,
these
if that
guys.
gets taken into consideration rather than the overall wealth of the town.
Yeah.
The number of children serviced.
Yeah, so definitely enrollment does factor into the amount of state aid. East Greenwich's enrollment has gone down. I think only by around like 18 or 20 students last year to this year. So that's not a huge
Is
hit
there
to it, but,
a portion that's targeted for
there's a-
special ed?
there is a for high cost special ed. So I believe anything that goes over a 4 times the what's the word I'm looking for?
Average pupil cost.
Yeah,
Per
the
pupil.
student cost, per pupil cost, gets reimbursed or gets sent to the town. I don't think at 100% though of that cost. So you know, Rhode Island needs to do a lot better with special education funding, because I know that you know educators like yourself do not have the resources they need to serve the students that need it.
Challenge.
Yeah.
I think I was gonna call on you.
Hi, I work for a restaurant in East Greenwich, and I want to go to the composting aspect of it, because obviously they produce a good amount of food waste, and like mostly food waste. So I was wondering kind of if there's like any kind of legislature that goes to restaurants when it comes to composting, or if that's like they're private and you kind of can't force them.
Yeah. So right now, our the what's called the food waste ban that we have on the books in state statute requires entities that produce a certain poundage of food waste are required to compost.
Is it similar to Massa's?
Sorry.
Is it similar to Massachusetts? But I know they don't have
I'm not sure
Okay.
how it compares to Massachusetts. And so things like restaurants, large educational entities are supposed to be composting. There is unfortunately a lack of enforcement. I think DEM and resource recovery are supposed to be doing that kind of thing. And so, you know, rather than take the stick approach, we're trying to use a carrot approach by creating this compost fund that will help people with training, with the setup for composting at businesses, at schools, and offer grants to get those things off the ground. Yeah.
Yes. Okay. Sorry, you?
Hi.
Sorry, I don't know what
My
everybody's
name's
name.
Anne Jerzak. I'm a healthcare provider in the community. And I'd like to ask, what legislation or initiatives do you see coming forward to help improve access to primary care in our state? There's a healthcare crisis amongst us. Daily I see so many people who have no access to primary care and other types of services, pediatricians and so forth. And this is a very important topic that needs to be addressed.
Yes, absolutely. Do you want to?
Sure, so the governor put in his proposed budget $200,000 to go towards physicians that move to or start their practice after graduating medical school in Rhode Island to help pay their student loans. And we increased Medicaid reimbursement rates last year substantially, so that hopefully more providers will be willing to accept Medicaid patients, because for years the reimbursement rates were not increased in proportion with inflation. So those are just a couple of the things that we're doing, but that's another reason why I want to get on the Health and Human Services Committee to see what else we can do, because it's an issue we're certainly hearing a lot about.
And so as a practitioner, are you a primary care provider? Is that what you said?
And what would you like?
Okay, we do it. Yeah. So I'm sure you're intimately familiar with this. You know, the physician shortage. Well, medical practitioner shortage it's a nationwide problem. It's not just Rhode Island. And I would hope that we could have ideally a federal response to this through student loan repayment programs. Or I don't hold out hope that that's going to happen anytime soon. So here in Rhode Island, we are taking a couple of different approaches. And this is something, the Senate last year, we released a package of health initiatives to try to start to deal with this problem. We are looking at exploring opening a medical school at URI. Right now, our only medical school here in Rhode Island is at Brown, and a lot of their providers, once they graduate, don't actually stay here in Rhode Island due to many factors, availability of housing, reimbursement rates, so they can get paid more by going to Massachusetts and by going to Connecticut, which are very close, and so very few stay here in Rhode Island. So we are looking at including primary care reimbursement rates in the biennial rate review that the Office of the Health Insurance Commissioner does, to kind of come up with what are those numbers, like where do we need to get reimbursement rates up to in order to retain and attract providers here. Let's see what else. The student loan repayment that Evan just talked about, it's not nearly enough. Massachusetts invests, I think, like more than $10 million a year in loan repayment assistance to primary care providers. And so, $200,000 is really just a drop in the bucket.
Yeah.
It's like we know nothing. Like most primary care providers that are coming out are saddled with like $250,000
So right
of
now,
debt
we
just
don't
per.
have any kind of pool or money for reimbursement or helping with student loans for medical.
There is a wave maker program that's not just limited to medical. It's if you graduate from school and you come and you're working here.
Yeah.
There's eligibility for that, but there's nothing specific to address this issue.
Yeah. Yeah, we need to create a pipeline right here in Rhode Island where we are training providers, we are helping them with tuition, we are investing additional money in clinical training sites, because right now we don't have enough people mentoring providers here because it costs money, and right now a lot of physicians providers will mentor people, but they don't really get paid for it, and so that's their time and energy that we were asking when they're already overburdened, doing all of the prior authorizations for services and for drugs. They're that kind of thing. So we're really need to take some of the administrative burden off of our providers as well. So something that me and a bunch of my colleagues are looking at is prior authorization reform. So whatever you're at does everyone know what prior authorization means? That's
Unfortunately.
Okay, good. I just like to make sure, because I know that we talk a lot about these things in the Health and Human Services Committee, and everyone's always like, what are you talking about? So kind of reforming prior authorizations a little bit, so that providers don't have to spend so much time and energy, chasing after insurance companies for coverage for their patients for, things like generic drugs that they've been prescribing forever, or for services. It's causing a lot of burnout, and we are not replacing our retiring providers, and new ones are, and a lot of people are leaving the profession because of it. One other effort is PBM reform. So our pharmacy benefit managers, they're kind of the middlemen between our between the insurers and our patients. We're driving drug prices way up for people. So those are just kind of some of the efforts that are underway.
Nicole?
Okay, I'm gonna try to be concise. It's kind of a complicated question. So, I don't know if this is an education question or a finance question, but so for the education funding formula, we already know this community is a low state share, meaning we pay approximately close to 90% of our education ourselves. And the high state share communities, let's insert, an urban, Central Falls, Pawtucket, Providence, etc. They get a lot of their education funded by the state. Okay, so that lives over here for a moment. In the government agencies bucket, the full-time employees that are in the government agencies, Rhode Island Department of Education has an FTE, full-time equivalent, cap. And in that cap of employees, a good portion of them actually are in Central Falls School District, are in Pawtucket School Districts, are in the Met. Rhode Island School for the Deaf, they're not really RIDE employees, so I have a couple questions. Do those count in their state share? Because you'll hear on like WPRI, like, oh, the urbans don't get enough. Really? I'm like, not only do they get the high state share, they also have employees paid for through RIDE. And then RIDE doesn't have the employees needed for like IDEA monitoring because they don't have enough FTEs. And when I spoke to someone on the Senate Education Committee, it didn't seem like there was awareness of that, in part because it doesn't sound like RIDE brings that to the surface. Does any of this sound like something that's discussed? Is the FTE cap talked about as a problem? Does it include it in the budget costs for CF, Central Falls and such?
So I don't know the answer to that question, but now I'm very interested to find out. And I will look into that.
Yeah, okay, thank
Yeah,
you.
yes.
I'm not gonna call you yet. Yes, Maria.
Good evening.
I wanted to, Maria, can you introduce yourself just
Sure.
because this is a
Happy
great
to.
opportunity for people to learn who you are.
Yeah, thank you.
I get to
My
know
name
you
is
as well.
Maria Bucci, a new town employee, and I've been tasked as Director of Prevention and Support Services. And so my job is to form a coalition around prevention with key stakeholders in the city, in the town, and just get the message out there. You know, prevention is, you know, worth a pound of cure, right? And you were talking earlier about human and health services, and I know Governor McKee just put in something, the Hazel Health.
Telehealth free.
Telehealth, right, for schools, right? So because there's such a backlog of people trying to get to providers for mental health, it's probably be coming down the pipe very soon. But it's gonna be available and it's free of cost. So anyone within, you know, kids who need help, who are struggling with anxiety or depression, can get online and get support. And that's really important. I'm coming from a point of prevention, right? Because mental health is involved in everything right now. And unfortunately, people with mental health issues go to substance abuse, or, you know, it can be a very slippery slope. And, you know, the studies that say that when people don't get the support they need when they're younger, it carries into their adulthood. So my question is, what your thoughts are on getting prevention within the schools, and of course at appropriate age level, but just getting the word out there about coping mechanisms, you know, support systems, and just knowing that, you know, it doesn't have to go that way. Does that make sense? Yeah. And I know there's such, you know, the one good thing I think that came out of COVID is that mental health is being talked about. We're trying to reduce the stigma of it. But for kids, it can be very overwhelming and they still feel bad. So just making it across the board kind of more accessible, so they can be healthier adults down the road.
Yeah, I mean, I guess I would want to know more about what is happening in the schools right now. And trying to maybe, I don't know, maybe our school committee members who are here want to weigh in on that, about what are the needs?
So as far as I know, it's maybe addressed once a year or maybe twice a year through a PE class or a health class,
Okay.
or a speaker coming in. But to build that consistency so that they learn what, you know, the coping mechanisms are, and that kind of thing that will be beneficial to them throughout their whole life, and hopefully won't get to the point of needing mental health.
Yeah. Okay.
Do you know what I'm saying?
Yeah. I mean, that's a big question.
I know.
I mean, I think having full-time staff in the schools that is, that is there to help with kids. I know in the elementary school levels. Well, actually, I can only speak for North Kingstown, and that's where I live, and that's where I have experience with my own children. Social emotional learning is a thing that is just built into the school day at this point at the elementary school level in North Kingstown, the coupled with the kind of like anti-bullying. I'm seeing that Allison Powell over here is just like, we have that too here. Okay, so good. So starting at a young age, I don't want to speak out of turn because I'm not an expert in this area. But if there are programs that
There
to
is
be
a
brought into
mental
the
health,
school.
there is a East Greenwich School Committee mental health or health and wellness.
Health and wellness.
Claire,
Which
Cecil
maybe
Cobb.
you need to tap into.
Yeah.
Okay.
Yes, the
Okay.
chairperson is Claire Cecil Carr.
Yes.
Yeah.
Yeah. Yeah. So I think, as you said, you work with the school committee. They're the ones that are on the ground in the school. Well, not on the ground in schools, but like, well, you are. Okay.
Right. You know, every issue is important.
Yeah.
You know, I mean, it's, obviously there's never enough money to go around.
Yeah.
But, you know, coming from a place where, you know, kids in adolescence, where they really struggle and sometimes go down the wrong path
Yeah.
because they don't have that knowledge. So prevention is just education.
Yeah.
So it's just getting it out there, you know, in a very non-threatening, hey, we're here to support you. So as a coalition, we're not like, hey, we want to take drinking away and all you bad people. It's nothing like that at all. It's supporting kids with what they need so they can be successful and go out and live their dreams. And if that's something that gets in the way, then, you know, as an educator, prevention specialist, it's our job to make them aware of what could happen.
I mean, so I don't have a great answer for you right now, but I'm happy to follow up with you and
Okay,
talk about
appreciate
things, you know, ways that I guess we could support legislatively, or if there are resources that we can connect you with in your new role. I'd be happy to have a conversation.
Marie.
Thank you. I spent some time yesterday afternoon at the State House
Oh,
when Evan is my representative, but I had to move to Warwick to get a one-family house on one floor. Anyway, but it was a Senate hearing on homelessness. Why what happened that the legislature last year said, here's $10 million, deal with it. And we've been paying one head of the acting head of the Department of Housing after another. And it occurred to me that in New York City, even when 100,000 asylum seekers were bused and flown in from the border states, they were all sheltered. It's in the New York Constitution, and at least the city of New York takes it seriously. Also, I recently came upon the fact that the historic housing credits, which have been so very helpful in turning, say, Lockwood High School in Warwick into housing and so on. We've got Eldridge School sitting there. But apparently there are exorbitant fees charged to the people who want to, you know, private people or nonprofit people who want to use these tax credits. So maybe it's cold outside.
I know. And you didn't see me, but I was in that hearing as well in the back. So yesterday there was a joint Senate hearing involving the Housing and Municipal Government Committee as well as the Oversight Committee on the Senate to talk about, you know, what the heck has been happening with our homelessness response here in Rhode Island, because as you know, it's very cold and we have not had enough shelter beds for people across the state.
Could I pipe in on that?
Yeah.
Apparently the number of homeless has gone up by 30%, but the acting director of the Department of Housing was proud to say that we have the same number of shelter beds this year as we had last year.
Yes. So you've identified a couple of problems. Yes, we have our the number of unhoused people in Rhode Island has gone up a lot over the last couple of years, largely due to lack of housing and rent prices, housing prices in general. We have had, I think, mismanagement at the Department of Housing. We are now on our 4th Secretary of Housing since in 3 years, I think, since it was created. And people in that department keep on passing the buck. Now we have Deborah Goddard has just started as the new Secretary of Housing, and she only started a couple of weeks ago. She was in that hearing yesterday. Some of the issues with the shelter beds are that the contracts with community organizations were not put out until I think like November or December, when they should have been done the previous spring.
And they haven't been paid.
The providers have not been paid, so they're at the end of their financial rope as well. I'd say mismanagement by the administration, quite frankly.
May I just speak? I've been the chairman of the Affordable Housing Commission in East Greenwich for 4 years. I'm not the chair this year.
Speak up just a bit if you can, Donna.
Okay,
Sorry.
I'll get my teacher voice out. How's that?
There you go.
Right.
Love it,
Okay.
love it.
I've been chair of the Affordable Housing Commission for 4 years. I lived in town for 53. I've seen all kinds of things. But a lot of the affordable housing that we have put out has been voted down by the town. We have tried to do more than we've been able to do. There is affordable housing coming on the local level in some places, but we have not had the support that we thought we'd have. So just to let you know, it's not just a state, it's also local.
It's a good segue because I know there's a lot of tension in locally and in communities like East Greenwich because the state has put out a lot of housing new legislation, kind of taking some local control back or away because cities and towns were not allowing enough. They had restrictive zoning.
Not in my
So-
backyard.
Yes, so there's real tension though, because of course we know there's a development for 400, actually I've got the story, it'll be posted tomorrow, but the 410 unit Division Road development there's a settlement now, and now the developer does have the right to proceed with that development through the preliminary plan phase. It will be going back through the planning department. There are some rules, it's gonna be half of it would be 55 and older. That will help with easing pressure on schools and on traffic patterns. But it's still 410 units off of Division Road in a part of the town that didn't used to have that kind of density. So it's hard. So I know there are some people in town who are wondering, I think you supported those. I don't know about you, Evan.
Yeah.
How do you speak to people who are worried about losing local control as we do need housing?
Sure. I think generally speaking, most local control is maintained. What we've tried to do is make procedures more uniform and streamlined.
Just a little louder, please.
We've tried to make procedures more uniform and streamlined throughout the state so that builders have an expectation of getting a yes or a no answer, and they know what the parameters are going into the project. And there's been consensus and buy-in on everything that has been passed at the state level from entities and advocacy groups representing employers and municipalities and builders as well. So it's been a pretty comprehensive, gradual process over the last 4 years to build a consensus on what we're doing and try and strike an appropriate balance between making sure that people that know these cities and towns best maintain final say over the most important decisions, but also eliminating unnecessary roadblocks in the process. So if there are things that folks think that we got wrong, that we should go back to the drawing board on, I'm all ears to listen, but I haven't heard any specific feedback on the legislation that has passed as to a specific problem with a specific bill. It seems like a lot of the issues are, I don't like this project in this area, which does put it as a local issue and an issue that you guys have to flesh out at the local level as to whether this specific project is right for the town. But like I said, I'm open to any feedback. If there's legislation that the town thinks needs to change, I'll sponsor the bill.
Anybody more on housing, just while we're on this topic? Denise and then Allison. Denise first?
I would just like to welcome you to come to one of the planning board meetings where these types of developments are discussed, because often the community members are left to feel, basically they say, we're not listening to anything about the schools, we're not listening to anything about the local impact. The developer has the right to develop the land because we have not met the percentage. But if you're adding 11 affordable, which affordable by their standards maybe is, I think the last one, maybe 200 to 300, which is reasonable, but you're adding in another 30 or 40 that are up in the $600,000 to $800,000 range. That's, again, the developer has the upper hand. We're still never going to achieve the percentage. And
We
the
are
residents.
making progress on the percentage.
But look
There
at the
have
loss of the
been-
land, at the loss of the community, at the loss of the, a lot of the historic or the character that this town, why people came here. So it's just looking for better balance. It's not saying, certainly I want something that a young family can come in and move into the district. But I also want to see the schools and the municipality supported. I'm a graduate of East Greenwich High School. I can attest that high school has not changed. When I came back with my family to see how much development in the area had gone on, all the different developments that had come, and nothing really changed in the town structure, we were bound to get to this point. And now you're gonna add more updivision. You're gonna add, looking at more Faith Hill Farm, where there's a functioning farm, but they don't have any rights for their horses because, well, it's the developer's right to do what he wants on the land, and we're doing you a favor not putting more than what we could. It's threats to the community, and the developer has the upper hand, and the community is just asking to be heard, and the planning board is telling us, well, it's the state. Don't talk to the town, talk to the state. So we're talking to you. I'm here talking to you, and there are others that would love to talk to you, to really understand how we can make this better for everyone. Because right now, you're gonna keep adding, and listen, Division is a safe road. Someone was just killed on Division Road. I go to the Four Corners. The congestion is horrible, and it's gonna get worse. There's no denying that. If you want communities that are, great for young families, put in sidewalks with the state. Like, look to, walk the block of what you're looking to achieve. Stop just chasing a number that, at the end of the day, is still not gonna solve the problems that you're looking to resolve. So.
Yeah, well, I
Let's
think.
let them address that.
Yeah, I mean, thank you for that feedback. Like Evan said, if there are things that we have gotten wrong in the in our housing laws, we're happy to
No, 'cause
suggest
I think it's,
changes.
I talked about it 2 years ago, nobody, affordable housing, when you bring it up, everybody just wants to shut you down, that you don't want, it's an NIMBY issue, you don't want it in the backyard, you don't wanna help someone, and that's not the case. We are stretched, people compliment and say, oh, look at North Kingstown, they have it right. Look at North Kingstown, it's just house after house after house. Is that what we want Rhode Island to become? How do we, better, the people that were just displaced from the fire, we can't even house them in East Greenwich, that's not right either. So we're still not solving problems by building. We have to really look at the solution and what's causing the root issue of why people can't get, either afford where they're going, or, why the prices are so high. You can keep building, but if look at the numbers for the one by Faith Hill Farm. So I think it's like $24 million that the developer, put in the initial proposal for what he's gonna make off of those houses. How much are we getting back to East Greenwich? And it's affordable, who's policing to make sure that he puts in those 11 units versus what else he plans to build?
Well, so to be clear, the deed restricted affordable units are legally required to
Yes.
be deed restricted affordable for 30 years.
And they are supervised by an agency.
There are agencies that oversee those things. There is definitely oversight of those affordable units. It's not
No, because there was something that, I don't have the exact details, but there was something that was talked about with the developer in particular, something in Westerly where it didn't go quite right, and, I don't know the details, so I'd rather not speak on it. If I find it, I'll send it to you, but, again, they're using it as a bypass to kind of put a development in versus actually trying to help solve the problem. Or without,
So,
the
I mean,
community
to be
input
clear, there
or-
are, developers are trying to make money. It's not,
Yes.
we live in a capitalist country. Yes, developers do build things to make money.
But you're elected to look out for everyone, so somebody has to start to look out for the community impact at some point in time, and at least allow a pause and plan. to be in place.
Yeah.
So
Great.
that's,
Great. Well, I'm happy to hear about specific ways that we can, introduce any amendments to the current laws to address your concerns.
There are impact fees that developers do pay. They do not pay them on affordables, or maybe that's the Section 8. Like, I think the Frenchtown development, that was not, they didn't need to pay an impact fee. But a developer, including that one, including the one who might develop the other one on Division, will pay impact fees, which are supposed to help offset all the, things that come with development. But we'll also get taxes from those properties as well.
Yeah.
Marie, quickly.
I used to be on the Affordable Housing Commission for a long time before Donna. And I think East Greenwich needs to recognize that when you get off the highway, you can do it not only at Division Street and Frenchtown Road off Route 4, but out by Cars Pond Road. And in fact, there's a shopping mall out there. It's a whole different world. And that is one of the reasons why when the town plan was developed 10, 15 years ago, that was said, oh, hey, that'd be a great place to have affordable housing. People will have access to public transportation. It's something I think we need to reimagine.
Yeah, we need more housing, and to address some of the congestion at the Four Corners. Federally, Senator Reid has and Senator Whitehouse have.
Yeah.
I guess our full federal delegation has secured money to do the missing move from 95 North to 4 South, which is the reason a lot of the tractor trailer trucks get off and drive through.
Right. At
drive
Division,
through
at Division
that
Route
part of
2.
East
That
Greenwich.
will help.
That will help.
It will be a little hard when it's probably being built, but it will
Yes.
really
Yes.
help that intersection. I think we have time for one more question, a different topic perhaps. Sorry, I'm gonna just somebody whose voice hasn't been heard. Back there, yes.
Hi, I'm Denise Telfaro. I was wondering, well, what's important to me, I'd like to see effort put behind is implementing legislation to help Rhode Island actually hit its Act on Climate goals. So just wanted to voice that, and then also hear where you are with the building decarbonization bill and what you think its chances of success are.
I'll address your first question first. So we passed the Act on Climate in 2021, which is supposed to put us on a path to net zero emissions here in Rhode Island by 2050. That built on the Resilient Roadie Act that came before that. And so the next phase of implementation of the Act on Climate is happening right now. So the EC4, oh gosh, I can never remember what the acronym stands for, but the EC4 is the statewide committee that is charged with coming up with like the plan for implementing the Act on Climate. Right now they're coming up with their 2025 plan, which is supposed to it involves DEM, it involves environmental organizations, things like that. Coming up with a plan for Rhode Island and how we're going to keep on moving forward to decarbonize our buildings, to move towards clean energy procurement, and things like that. So that process is happening right now. I believe the report's supposed to come out in early 2026. So we'll have more visibility on what that would mean. I mean, meanwhile, we've been implementing various things here in Rhode Island. Rebates on electric vehicles, helping people offset the costs of converting to electric in their in homes. The building I know.
Compared to Massachusetts, it's peanuts.
I know, we need to do more. I mean, compared to Massachusetts, a lot of stuff we just peanuts, unfortunately. So the building decarb act, I'm not really sure kind of what its chances are this year. I believe my colleague Megan Coleman has that bill, and she's an incredible advocate. So I'll find out from her, and if you want to email me, I'd be happy to give you an update on where that's at.
Great, thank you.
I think we have to stop now to let Evan get home, but, you did say, you both, so if these guys wanna reach out, and you guys have more questions, I'm really sorry we can get to all of you, but phone number or email, it's on the web, it's on your.
My
If
phone-
you just Google us, our state house email and phone numbers come up. We both have websites with our business. that I think
My
we do
cell
right
phone's
now.
on there too, so
Yeah.
call, text, email, whatever.
If you want to come up right now, I'm happy to give you my number.
Yeah.
And he does answer.
So do I.
Yes.
People are surprised.
Thank you all so much. We still have treats and coffee over there. It's decaf from Felicia's. That was great. Thank you both, Bridget and Evan. Really
Thank you.
appreciate it.